Good day, all. This talk will look at how private healthcare works in Canada. My previous talk on the history of Canadian healthcare showed that most of the 20th century saw the steady growth of public healthcare going from municipal to provincial to federal levels. But in the late 1970s, the federal government implemented major cutbacks to Medicare funding, and in the 80s, a new wave of right-wing politicians began to promote privatization of all government services, including healthcare. In the US, this privatization was swift and thorough. American healthcare was almost completely privatized in the course of the 80s and 90s. Canadians have proven to have a stronger commitment to public healthcare. Medicare is just too popular for right-wing politicians to scrap it. However, they have consistently underfunded it in an effort to force the general public to turn to private healthcare, and they have diverted public funds to private healthcare corporations whenever they could. As a result, since the 80s, Canadian healthcare has undergone what I call a creeping privatization. The private sector has nibbled away at the edges, gradually extending its presence to where today about $1 in $3 that Canadians spend on healthcare goes to the private sector. In other words, Canadian healthcare has been about 1/3 privatized. So, today, Canadians face a choice for the future: public healthcare or private healthcare. But to answer that question, we first need to answer another. Which works better? Which system provides the better care? Not surprisingly, both sides claim to do it better, so we can't just take either of their words for it. We need to examine the historical records of public and private healthcare and compare the two. So, I'm going to compare public and private healthcare in Canada. However, before we get into the history, I just want to summarize for you what the facts show. Firstly, despite the private sector's claims that it can do things more cheaply, private healthcare costs, on average, 3 times what public healthcare costs, and sometimes much more than that. Privatization always means fewer services at higher prices. It means a healthcare system that increasingly caters to the rich, increases inequality of access to healthcare, and provides less and less coverage for more and more people. The US shows Canada its future if we privatize healthcare to the extent that the US has. The US already has a 2-tier healthcare system, where about 75% of all healthcare resources go to the richest 10%, while the other 90% of the population make do on rich people's leftovers. This is because private healthcare corporations are not there to provide a public service. They're there to make a profit. And when you care for profit, all you care for is profit. Since privatization in the 80s, US health standards have significantly declined. Probably the main reason that the US had the world's highest rates of COVID infection and death in 2020 is that the US now has what the World Health Organization ranks as one of the worst healthcare systems in the developed world. This is so even though the US now spends far more on healthcare than any other country in the world. In short, private healthcare provides the best of care for the rich and the worst of care for the rest. So, to answer my question, if you're rich, private healthcare works better for you. But if you're not, then public healthcare works better. I'd like to end my introduction to private healthcare in Canada with a brief anecdote. In 2002, former Saskatchewan Premier Roy Romanow submitted the Romanow Report, a Royal Commission report on healthcare in Canada. The following year, in 2003, he spoke at the University of Regina, and I attended his talk. He said that the goal of the Royal Commission was to find the best way forward for Canadian healthcare, so they looked at both public and private healthcare. He and his fellow commissioners travelled all across the country and spoke to people in both public and private healthcare. To the private business owners, they said, "We're open to all options. Provide us with any concrete evidence that private healthcare works better than public healthcare, and we shall support privatization." But not a single businessman in Canada could provide any such evidence because there is none. Every reputable study that I know of comes to the same conclusions that I outlined above. This is why I would argue that far more than COVID or any other single illness, it is privatization of healthcare that is the single greatest danger facing the health of Canadians today. The privatization of Canadian healthcare began in the US. As I said in the previous talk, an oligopoly of big corporations took control of American healthcare in the 80s. Once they did, it was inevitable that the next place they wanted to expand into in search of fresh markets and fresh profits was Canada. But when they tried to do so, they encountered a difficulty. Most Canadians did not want private health care. Opinion polls through the 80s and 90s consistently showed that 80 to 90% of Canadians were satisfied with Medicare, that 80% favoured a continued or even expanded role for the state in healthcare, and that less than 10% would prefer a privatized healthcare system. The corporations concluded that Canadians have what they called an entitlement mentality, meaning the ridiculously egalitarian idea that healthcare is a right to which every Canadian citizen should be entitled, not just the rich. So, the corporations launched a massive advertising campaign to change Canadians' minds about Medicare and about private healthcare. In this, they had the backing of the new right politicians who came to power in the 80s. Ronald Reagan in the US, Margaret Thatcher in the UK, and Brian Mulroney's Conservatives in Canada. These right-wing governments all promoted the claim that increases in social program spending on health, education, and welfare were forcing governments deeper and deeper into debt. It was argued that, with the economic recession of the late 70s and 80s, Western countries could no longer afford to spend so much on welfare state measures, and so cutbacks had to be introduced. In Canada, it was argued that the cost of Medicare in particular was spiraling out of control and had to be cut back. And so, between 1988 and 1998, the federal government cut $36.5 billion from the federal healthcare budget. This resulted in the closure of nearly a third of all hospital beds nationwide, as well as hospital staff reductions, closure of outpatient services, delisting or removing Medicare coverage from some medical services, growing deductibles, especially for drug plans, and most famously, lengthening waiting lists. Canadians were being accustomed to the claim that we just could not afford good universal health care anymore. The right-wing claim that social programs were responsible for growing government deficits was accepted and repeated endlessly by the Canadian media, which is also mostly right-wing. Yet this claim was and is almost entirely untrue. In 1990, Statistics Canada released the Mimoto study, which looked at the increase in government debt from 1975 to 1989. The study concluded that only 6% of this increase could be attributed to higher social program spending. The other 94% was due to growing tax breaks for corporations, growing subsidies for corporations, and borrowing from private banks and then allowing them to raise their interest rates. Both Conservatives and Liberals steadily dropped the corporate tax rate through the 80s and 90s. In 1956, corporate taxes accounted for about 50% of government income. By 1996, it was only just over 10%, which it still is. It is this change in taxation policy which has left our governments short on money, not the cost of social programs. Moreover, despite being supposedly short on cash, the federal government has continued to give out so-called corporate transfer payments or subsidies, which are really just government handouts to big corporations. From 1980 to the present, these have averaged $23 billion a year, or $1,500 per taxpayer. It is literally the same as if every year, every Canadian adult went up to some corporate millionaire and gave them $1,500 just because. This is why it's been argued that in the 80s, the welfare state was transformed into the wealthfare state. Welfare for the wealthy. While right-wing politicians claim to act for the general public, they've really acted to funnel more and more taxpayers' dollars to their rich corporate backers and to promote the private takeover of government services. Once cutbacks had begun to cripple public health care, the 90s saw the next stage in the corporate propaganda campaign, a barrage of claims that private healthcare was the cure for the problems of public healthcare. The corporations decided to give their campaign an academic veneer by creating so-called right-wing think tanks like the Fraser Institute, based in Vancouver. In the 90s, the Fraser Institute put out several so-called studies claiming that Canadian healthcare would be improved if it had less government involvement and more corporate involvement. This is, of course, what the Fraser Institute says in all of its studies, because that's what their corporate bosses pay them to say. In the late 90s, Other such think tanks, like the Institute for Research on Public Policy, based in Quebec, put forward the idea of establishing internal markets, where governments contracted services to private companies. At first, this idea did not gain much support, but then they came up with a catchier name for it: Public-Private Partnership, or P3. This sounds fancy, but in practice it's simply a government contract given to a private corporation to do some job for the government. P3s became popular in the late 90s and 2000s, but their use declined in the 2010s as evidence mounted that, despite the private sector's claims that they could do things more cheaply, P3s were always much more expensive than using the public sector. Indeed, I would argue that what P3 really stands for is prices triple. I've already said in other talks that on average, private healthcare costs triple what public healthcare does, and that doesn't just apply to healthcare. Since the 90s, Canada has had over 200 P3 projects, mostly in construction. And whether they're building hospitals, schools, roads, or whatever, P3s cost, on average, 3 times as much as using the public sector. Despite this and other problems, right-wing politicians have continued to support P3 projects. For example, the right-wing Saskatchewan Party paid $407 million for a P3 project to build a hospital in North Battleford. The hospital opened in 2019, and the Saskatchewan Party stated that it was, quote, very pleased with the project, even though an independent audit in 2020 identified over 200 construction deficiencies in the hospital. In other words, the private contractor did over 200 things wrong, but the Saskatchewan Party still thinks they did a great job. Ideology blinds right-wing politicians to reality. I would argue that when it comes to healthcare, public-private partnership is what in Poland they call fried snowballs, meaning a physical impossibility or a contradiction in terms. This is because the private sector does not want a partnership with the public sector. It wants to do what we've already seen it do in the US. It wants to destroy and take over the public sector. This is because private corporations always want to expand so as to increase their profits. But in Canadian healthcare, the only way for them to expand is to take patients away from the public sector. Private healthcare can only grow by consistently attacking and undermining Medicare. So, when people ask, what's wrong with having both private healthcare and public healthcare? That's what's wrong. The private sector will not live and let live with the public sector. It will constantly try to privatize healthcare more and more. Allowing private healthcare corporations into North America's public healthcare system was like putting the wolves in with the sheep. The wolves will try to eat the sheep because that is their nature. In the US, they gobbled up public healthcare very quickly. In Canada, they've had to go more slowly, but they have made progress, and they're not going away. Right-wing provincial governments also found other ways to support healthcare privatization. Already in the early 80s, they began to pressure hospitals to adopt so-called outsourcing. This began with hiring private companies to provide laundry and catering, and by the mid-80s, a majority of these so-called hotel services had been privatized. Outsourcing was then expanded into what was called strategic partnering, which meant privatizing most outpatient services, including rehabilitation services, diagnostics, laboratory services, and X-rays. Canada's largest private healthcare corporation is Toronto-based MDS Incorporated. MDS was founded in 1969 and grew quickly by buying up Ontario's independent doctor-owned medical labs. These labs performed most of their testing for the government and so got most of their money from the government. But the more MDS gained control over Ontario's labs, the more it raised its prices. Between 1980 and 1990, per-person lab services in Ontario more than tripled in price, as usual, becoming by far the most expensive lab services in Canada. Yet, despite this, MDS has now expanded all across Canada. It currently has revenues of over $1 billion a year, and it's still growing. Thanks to support from right-wing provincial governments all across Canada, private healthcare expanded in the 80s and 90s. For example, Manitoba, in 1984, had just 4 private healthcare companies. By 1994, it had over 100. Alberta went further than any other province by supporting what were in practice private hospitals. The Canada Health Act outlaws for-profit hospitals, but the corporations got around that by saying that it was not a hospital, it was just a big clinic, or what they called a surgical center. In 1997, the Health Resources Group, HRG, opened the Health Resource Centre, HRC, in Calgary. This was, in practice, Canada's first for-profit hospital. In 2004, Premier Ralph Klein's Conservative government gave HRG a $6 million contract to perform surgeries, even though HRG charged 10% more per procedure than public hospitals. But in 2010, the Alberta government had to give HRG $2 million just to keep it out of bankruptcy, and shortly after that, the government went to court to get out of its contract. By 2006, Canada had 23 private surgical centres, but other provincial governments, after initially supporting them, have also tried to get out of their contracts because they're just too expensive. In 2003, Ontario's Conservative government continued the process of nibbling away at the edges of public health care by signing contracts with Canada's first private MRI and CT diagnostic units. The Liberals promised to cancel these contracts when they came to power, but in fact, they expanded them. And from Ontario, the idea has spread across the country, coming to Saskatchewan in 2016. Premier Brad Wall's Saskatchewan Party government authorized them, justifying this with the argument that having private MRIs as well as existing public MRIs would reduce wait times, especially since the contract says the company has to perform one public MRI for every private MRI. This seems perfectly reasonable, except that it hasn't worked out that way. In 2015, the average wait time for an MRI in Saskatchewan was 28 days. In 2019, the average wait time for an MRI in Saskatchewan was 80 days, and by 2022, it was 86 days. From 2015 to 2019, the number of people in Saskatchewan waiting for an MRI rose from about 5,000 to over 10,000, which it still was as of 2022. Similarly, by 2022, the average wait time for a CT had risen to 73 days, with close to 10,000 people waiting for one. And in practice, the provincial auditor has found that private clinics perform far fewer public MRIs than private MRIs, and the government lets them get away with it. Saskatchewan residents have been left with a choice: wait months for a Medicare-funded MRI, or pay a private clinic $1,000 and get one right away. Those who pay privately become queue jumpers, pushing back the public pay patients still further. This is typical of the two-tier healthcare which privatization always brings with it. Alberta, which introduced private MRIs a few years before Saskatchewan, has had very similar results. How is it possible that more MRIs actually mean longer wait lists? For two main reasons. Firstly, because these private diagnostic units hire nurses and technicians away from the public sector at a time when there's already a shortage of both. This slows down work in the public sector and lengthens its wait lists. And secondly, and even more importantly, because of advertising. Private companies make more money the more MRIs they perform, so they advertise and promote their services both to doctors and to the general public. More and more people get MRIs just in case, even though they don't really need one, and that increases the wait time for those who do really need one. In Saskatchewan in 2016, 39,000 patients were referred for MRIs. By 2019, it was over 46,000. This is another example of how introducing private healthcare may seem to complement or improve or expand on Medicare, but in reality only makes things worse. Recently, the federal government has notified the Saskatchewan Party that these private MRIs contravene the Canada Health Act, so we shall see how long they continue to operate. Privatization of healthcare has not just been promoted by right-wing politicians and healthcare corporations. It has also, as in the US, been promoted by private insurance companies. And just as in the US, private insurance companies first began to expand their presence in healthcare insurance in Canada through workers' compensation. Workers' comp has always been separate from Medicare, but up to the early 90s, it was run by workers' comp boards, which were non-profit organizations made up of representatives of the employer, the employees, and the state. These boards cost about half of what American private workers' comp cost and still provided employees with 4 to 5 times as many healthcare benefits. Yet, in the 90s, many employers withdrew from the boards and instead started buying insurance from private insurance companies. These companies set up the same managed care system as in the US. Higher rates, lists of doctors and services that workers were restricted to, including privatized workers' rehabilitation services, and so on. They've also introduced so-called flexible benefits plans, which in practice means that their standard insurance package only covers minimum services, while more thorough coverage costs more. As healthcare analyst Shari Caudron put it, this system focuses on demand management and, quote, the overall intent is to reduce healthcare utilization, not illness. In other words, the goal is not to make workers healthy, it's to provide them with the minimum amount of care that they can to get them back to work. Also in the 90s, some hospitals, such as Winnipeg's Seven Oaks General Hospital, hired US medical management companies to implement managed care principles. Services were reduced, beds were closed, and the length of hospital stays was reduced, all in the name of cutting costs. The final field of privatization of healthcare that I'm going to examine is a field that has been much in the news lately, the field of elder care. So I'm going to take a brief look at the history of elder care in Canada, focusing on Ontario, which has had the most extensive privatization. In the early 20th century, all nursing homes for elder care were privately run, either by charities or by small family businesses. This changed in the 50s and 60s with the creation of Medicare. The state got involved in elder care, and non-profit homes for the aged were set up, usually run by municipal governments. In addition, legislation was passed to regulate private nursing homes, in particular the 1966 Nursing Homes Act. This legislation was passed in response to a growing public outcry over the atrocious conditions in many private nursing homes. Studies showed that their residents were often overcrowded, underfed, neglected, robbed, abused, and left with little or no competent medical care. A 1965 study by the Ontario Welfare Council found that 165 of 425 nursing homes provided substandard care, over a third. The stricter regulations introduced in 1966 did improve standards, but the Act had the unintended consequence of creating another corporate oligopoly. Many mom and pop nursing homes couldn't afford to maintain these higher standards, and so they were either taken over or consolidated into corporate chains. By 1974, Ontario had 75 such chains, of which the largest was Extendicare. By 1989, Extendicare was the fourth largest nursing home chain in North America, owning over 60 Canadian nursing homes and over 150 American nursing homes. In the late 70s, these Ontario nursing homes organized themselves into the Ontario Nursing Home Association, the ONHA. The ONHA has been very successful in getting the Ontario government to support growing privatization of elder care. Between 1973 and 1984, 6 times as many new extended care beds were granted to private nursing homes as to public homes for the aged. From 1979 to 1983, the private long-term care sector expanded by nearly 40%, while the public sector expanded by only 5%. And in the year 1982 alone, private nursing homes were granted licenses for over 8,000 new beds, which took the private sector from 47% of total beds to 54% of total beds. In other words, from a minority to a majority. How did the ONHA influence Ontario politicians to expand private elder care so dramatically? Again, in two main ways. Firstly, many of the ONHA's officers consist of former government officials who are given high-paying jobs in the ONHA, both as a reward for the government contracts they gave to the company while they were in government and for maintaining contact with the present generation of government officials. And secondly, there is that form of legalized bribery known as campaign contributions. For example, in 1982, the single largest contribution to the election campaign fund of the Ontario Conservative Party was a donation of over $10,000 made by Canadiana Nursing Homes Limited. And just a few months after receiving it, the Tories authorized thousands more beds for private nursing homes, most of them paid for by the taxpayers. Coincidence? I think not. Rather, this is capitalist democracy in action. Money talks. In the 80s, public protests began to mount against this growing privatization of elder care. Relatives and friends of the elderly organized a number of lobby groups to fight back. These organizations generally had long, boring, but well-meaning names, such as the Concerned Friends of Ontario Citizens in Care Facilities, which in 1982 put out a declaration that most of Ontario's private nursing homes were, quote, sterile, friendless, and lacking humanness and warmth, where old people sit and rock or stare at the walls. Their days are regimented. They are told when to get up, when to lie down, when to eat, when to bathe, when to go to the bathroom. Many are not even dressed and live their lives in bedclothes and slippers. If they protest at the treatment they're receiving, they're considered difficult and may be restrained or medicated. All of this has contributed to nursing homes being seen by the public as inadequate, hopeless places where old people go to die. Many other community organizations issued similar statements, such as the Advocacy Centre for the Elderly, the Ontario Coalition for Nursing Home Care Reform, and the Social Planning Council of Metropolitan Toronto. Also, the Canadian Union of Public Employees, CUPE, representing over 10,000 workers in the field of elder care, issued a report very critical of private nursing homes, as did the Ontario Liberal Party. The Ontario NDP went further and called for all private nursing homes to be phased out, a proposal that was supported by the Canadian Medical Association, whose 1984 Task Force on Elder Care concluded that, quote, when an institution becomes the only answer for the care of an elderly person, it must be one that is run on a principle of loving care, not tender, loving greed. Under this barrage of public protest, privatization of elder care was slowed down, and in 1987 the Nursing Homes Act was amended to force nursing homes to submit financial statements and to accept a Residents' Bill of Rights. However, a study by Vera Tarman concluded that these were mostly just symbolic gestures. Provincial governments accept financial statements which are so general and confused that profit margins are impossible to determine. Inspections are still cursory. Regulations are not enforced. And the Bill of Rights has made little or no difference to the quality of residents' care. Many private nursing homes continue to provide substandard care, and governments continue to turn a blind eye to this unless the general public forces them to do something. This does happen sometimes. For example, in 2004, CTV's W5 news program aired video footage of elders being abused and robbed in 2 Ontario nursing homes run by Central Care Corporation. In response, those employees directly responsible were fired, and the Ontario government increased the number of unannounced inspections of nursing homes. However, such piecemeal measures have made little difference to standards of care. The 2020 COVID pandemic once more demonstrated that on average private elder care is of significantly poorer quality than public elder care, but also that our public elder care could also improve. Over 80% of Canada's COVID deaths have been in elder care institutions. And in Ontario, there were 4 times as many deaths in private nursing homes as in public homes for the aged. In British Columbia, non-profit homes spend over $9,000 per resident per year more than do for-profit homes. And as a result, only a quarter as many public homes as private homes had a COVID outbreak. 3% of public homes, 12% of private homes. In Saskatchewan, just 5 of our 152 elder care homes were private, all run by Extendicare. But the worst COVID outbreak in any elder care home in Saskatchewan was in Extendicare's Parkside facility. Of 198 residents, 194 were infected and 42 died. This was the deadliest viral outbreak in Saskatchewan's history. The situation became so bad that the Saskatchewan Health Authority had to take over operations. Having done so, they of course examined how Extendicare had been running the facility. They found a long list of shortcomings, including overcrowding, inadequate staffing, inadequate sanitation, inadequate ventilation, inadequate infrastructure, which included both buildings and furniture in need of repair, inadequate use of personal protective equipment like masks and gloves, and perhaps worst of all, that when staff started to feel unwell and exhibited COVID symptoms, instead of being told to go into quarantine, they were harassed to come to work anyway because they were so short-staffed. In 2022, the Saskatchewan Health Authority announced that it was severing ties with Extendicare and taking over the operation of all 5 of their facilities. This measure has come in response to renewed calls for the banning of private elder care. Elders are vulnerable and need a lot of care, which is why they need to be looked after by state-run homes which put their well-being first, not by corporations which always put profits before people. This look at the historical record of private healthcare in North America has established certain facts. Private healthcare is primarily about making profits, not improving health. Private healthcare provides excellent care for the richest 10%, but for the rest of society, it means higher prices, less access to healthcare, fewer services, and often substandard services. By every measurable criterion, private healthcare is both less efficient and less humane than public healthcare. Yet, the private sector has taken over healthcare in the US and about a third of healthcare in Canada. How is this possible? I would argue that there are 5 main reasons or causes of privatization of healthcare in Canada. Firstly, money talks. We saw when we looked at the privatization of elder care in Ontario that politicians could be persuaded to support privatization by being rewarded with well-paying corporate jobs, campaign contributions, and plain old-fashioned bribery. In capitalism, politicians and government contracts can be bought, just like anything else. The more right-wing the party, the closer its ties to big business. So, in Canada, conservative politicians are the most likely to be in some corporation's pocket, but it can and does happen with all the major parties. Secondly, there is the influence of the US, meaning both US corporations and the US government, which have largely worked together. US healthcare corporations wanted to expand into Canada in the 80s, but at first they had difficulty in doing so, primarily because Canada had laws against both private healthcare and too much foreign ownership, including US ownership in Canada. But this changed in 1989, when Canada and the US signed the Free Trade Agreement, the FTA, which was renamed NAFTA in 1994 and the USMCA in 2018. The Canadian public has been told that these agreements are primarily about free trade, meaning the elimination of tariffs on imports so that prices could be lowered on both sides of the border. In reality, however, this is just one small part of what these agreements do. I would argue that they should really be called deregulation agreements, because they've scrapped most of the regulations limiting what US corporations can do in Canada and what Canadian corporations can do in the US. President Reagan introduced deregulation in the US, and through the FTA, he basically exported this policy to Canada. The FTA had a major impact on healthcare in Canada, primarily because it removed the previous 25% ceiling on foreign ownership in the insurance industry. This triggered a wave of cross-border takeovers going both ways. Large US insurance companies like Aetna, Prudential, and Mutual of Omaha bought up a lot of small Canadian insurance companies, while large Canadian companies like Great West Life Assurance did the same in the US. As we've seen before, this kind of takeover spree inevitably leads to the emergence of a corporate oligopoly, where an industry is taken over by a small number of large corporations. In Canada, in 1995, there were over 140 life and health insurance companies with total assets of over $165 billion and revenue of over $45 billion a year. But this wealth was very heavily concentrated. The top 4 companies had nearly half the market between them. The top 10 had about 75%. And the bottom 84% of companies had less than 1% of the market between them. In other words, there was a handful of big, rich corporations and a lot of small family businesses just getting by. This is the normal situation in every sector of the economy these days. The problem with it is that once a handful of corporations control a sector of the economy, in practice, they stop competing. Instead, they make illegal backroom deals to all keep their wages low and all raise their prices together, which is called price fixing or price gouging. This is exactly what happened in the insurance industry. By the mid-90s, private insurance premiums had been raised to where they brought in double what the insurance companies paid out in benefits. In other words, they had created a 100% profit margin. Deregulation and the FTA not only triggered the emergence of a corporate oligopoly in the insurance industry, they also ensured that this oligopoly would cover both Canada and the US. A single North American private insurance industry was created by a process of cross-border integration. By the late 90s, Canadian insurance corporations were making as much money in the US as they were in Canada. So, the same few big corporations came to control private insurance in both countries. Whether they're Canadian or American ultimately matters little, because they all want the same thing. They want to do in Canada what they did in the US, to take over and privatize healthcare. Medicare, or public healthcare insurance, is in effect the heart that pumps money through Canada's healthcare system. If Medicare were to give way to private healthcare insurance, then, just as in the US, we would have a fully privatized healthcare system in just a few years. While that is not currently on the agenda, it remains the ultimate goal of every single one of these corporations. And given the trillions of dollars in assets which these corporations have, this means that public health care in Canada is under constant attack by some of the richest and most powerful organizations in the world. Only the law can protect public health care. The state must protect state-run health care. But the FTA stripped away much of that protection and opened the door to allow US private healthcare corporations into Canada. Thirdly, there was the there was the takeover by private sector management of healthcare administration, especially hospital administration, in the 80s. These managers always have a strong ideological commitment to the private sector. They subscribe to the business ideology that profits come before people, and they continue to promote privatization and to believe that the private sector always does things better and cheaper than the public sector, even when the numbers say differently. This is partly because this belief is reinforced by self-interest. Just as with politicians, if a hospital administrator gives a big outsourcing contract to a private company, then after a few years he can expect to move on to a high-paying job with that company. Doctors are committed to the healthcare system for life, but private managers expect to move into different areas of the economy every few years, most of them in the private sector. So, their primary commitment is to the private sector, even when they're working in the public sector. If private corporations are like wolves, then these managers are wolves in sheep's clothing, working inside public healthcare to privatize it. Fourth, private healthcare creates problems for public healthcare. Sometimes it does this deliberately, sometimes accidentally. But either way, it then turns round and claims that these very problems are evidence that public healthcare is not working. For example, the media's biggest complaint about public healthcare is that waiting lists have been growing longer. But one of the main reasons for this is that increasing numbers of public pay patients are getting bumped to the end of the line by higher paying private patient queue jumpers. This problem only exists because of the private sector. More broadly, the media have complained about the growing cost of Medicare. And indeed, by the mid-90s, healthcare accounted for about a third of most provincial budgets, which it still does. But the main reason for this was the growing bill from the private sector. Prices rose by far the most in those areas of healthcare that were privatized, such as outsourcing, laboratory services, rehabilitation, and pharmaceuticals. Another problem arises from the private sector's practice of what's been called cherry picking or cream skimming, which consists of siphoning off the least sick patients, who are usually high income, to private institutions, while leaving the difficult, chronic, low-income, long-term care cases to the public sector. This is done to maximize profits, but it also puts more pressure on public healthcare and makes the private sector's record look better by comparison. But the biggest problem by far, which the private sector has created for public healthcare, is the constant pressure that corporations have put on the government to implement cutbacks to all social services, especially healthcare. By the end of the 60s, Medicare had given Canada a publicly funded healthcare system which, with just reasonable budgetary increases to allow for inflation and population growth, could easily be providing excellent and free healthcare to every Canadian to this day. But instead, the late 70s, 80s, and early 90s was the age of cutbacks. Although no one of them was crippling, healthcare suffered what was called the death of 1,000 cuts. While some of this funding was restored in the late 90s and 2000s, Medicare remains chronically underfunded and starved of resources. Government after government keeps telling Canadians that we just can't afford the kind of universal healthcare we used to have in the late 60s. Yet this claim does not stand up to the figures. In the late 60s, Canada's annual gross national product was just under $100 billion. Today, it is over $2 trillion. In other words, our economy is more than 20 times as large as it was in the 60s. Yet we could afford Medicare then, but we can't afford it now? I don't think so. Medicare is not underfunded because the government doesn't have any money. It is underfunded because right-wing politicians want to force Canadians to turn to the private sector. Without the problems which chronic underfunding has caused for Medicare, private healthcare corporations would never even have got their foot in the door in Canada. Yet, in a vicious circle, the private sector then uses those very problems to support calls for still further cutbacks to public health care. Fifth and finally, private corporations have developed a cunning strategy to promote public support. They tell lies, otherwise known as advertising. The private sector always claims to do things better, cheaper, more efficiently. But the numbers say otherwise. As I've said before, non-profit Canadian hospitals offer 3 times as much care per dollar as for-profit US hospitals. Non-profit Canadian workers' compensation boards offer 8 to 10 times as many benefits per premium dollar as American private workers' comp insurance. For-profit healthcare is always more expensive than non-profit healthcare because, by definition, its prices must include a profit margin, which public healthcare does not. As we've seen, privatization has immediately led to significant price increases wherever it has been introduced. On average, as I keep saying, prices triple. Private corporations tell many more lies. Another common lie is the claim that the private sector increases customer choice. As we've seen, this is the opposite of the truth. Private insurance companies actually restrict customers' choice to selected lists of doctors and services. Another charge that the private sector often levels at the government is that it is over-bureaucratized, and so that the private sector can provide lower administrative costs. But a 2003 study by Harvard Medical School found that healthcare administrative costs in Canada were $307 US per patient, but in the US they were $1,059 US per patient, or just over triple, as usual. The study attributed this higher cost primarily to 2 things: duplication of records by having many private insurance companies instead of just one centralized Medicare database, and to private insurance companies having to hire a lot of insurance claim adjusters and expensive lawyers to fight the endless lawsuits that private healthcare brings with it. I would argue that those lawsuits alone demonstrate that private healthcare is not providing an adequate service to the general public. The final private sector claim I want to examine is that we must choose between equality and efficiency. We're told that the public sector may provide equality, but the private sector provides efficiency. Well, not only is the private sector not more efficient, but efficiency in healthcare must surely be defined as providing the cheapest healthcare to the greatest number of people. By this definition, equality does not get in the way of efficiency. On the contrary, equality is essential to efficiency. Inequality creates inefficiency. It skews the distribution of healthcare resources towards the rich, leaving most of society with inadequate healthcare. Equal and universal access to healthcare is the only way to provide efficient healthcare on a national scale. The private sector's lies are easy to see through if you have the facts, but most people do not. Most people don't take sociology of health courses or watch this podcast. Most people only know what they see on the media, and the media are big businesses which present big businesses' viewpoint. Supported by right-wing politicians and right-wing business leaders, the Canadian media since the 80s has run countless articles criticizing Medicare and promoting private health care, and it still is. However, while it had some early success, in the 21st century this propaganda campaign has made very little headway with Canadians for one simple reason. It's been counteracted by the steady stream of horror stories about private US healthcare coming across the border. Canadians visit the US and hear from family and friends how the cost of healthcare drove them into bankruptcy, or they fall ill themselves and receive astronomical bills from private healthcare companies. Either way, most Canadians know now that private healthcare is expensive healthcare, and this has renewed their commitment to Medicare. Whatever its flaws, Medicare has become a part of Canada's national identity. It is one of the things that, to put it bluntly, makes Canada a better country to live in than the US for all but the rich. And most Canadians, like me, are proud of it. Now, after all my criticisms of the private sector, you may think that my conclusion is that there simply is no place for private enterprise in healthcare. But actually, my position is not quite that simple. For many years, there's been an ongoing debate between right-wingers and left-wingers concerning the appropriate roles of private capital and the state, not just in healthcare, but in the economy as a whole. The right calls for privatization, the left calls for nationalization. The right says private capital does things better, the left says the state does things better. Well, I would like to propose a radical compromise. Maybe, just maybe, the private sector does some things better and the public sector does other things better. Is there a simple way to figure out which is which? I believe that there is. The most basic division in any economy is that between goods and services. Some people make products for others or provide goods, while other people do things for others or provide services. I would argue that the private sector is better at providing goods, while the state is better at providing services. When it comes to healthcare, this means that corporations should provide the cures, while the state should provide the care. In industrial society, large-scale private enterprise is all about industry, machinery, technology. And when it comes to technology, capital beats the state every time. From the Industrial Revolution of the 18th century to the present day, capitalism has created an explosion of technological innovation such as the world has never seen before. The creation of the world market has given businesses the opportunity to make a lot of money very quickly if they can just come up with some new gadget that people will buy. So, when it comes to the invention of new medical technology, we should also look primarily to the private sector. New laboratory equipment, prostheses, pharmaceuticals, or new techniques like genetic modification. In these areas, the private sector has largely led the way and will continue to lead the way. The private sector also excels in using its technology for mass production. Capital does not just invent new technology, it invents technology to make that technology. It invents production goods to manufacture consumption goods. This means that if capital can make one of something, then it can make millions of it. And capital will find a way to make the most goods that it can as quickly, cheaply, and efficiently as it can. Accordingly, when it comes to supplying the healthcare system with the physical goods that it needs on a mass scale, like equipment and pharmaceuticals, it is the private sector that is best equipped to do so. The private sector should provide our healthcare system with its cures. The historical record clearly shows the superiority of the private sector when it comes to technology and mass production. When the state took over the economy in the Soviet Union, technological innovation quickly ground to a halt because government bureaucrats have no incentive to innovate. On the contrary, anything new just makes more work for them without any additional rewards. Similarly, the Soviet state proved to be very bad at mass production. In the Soviet bloc, goods of all kinds were always in chronically short supply, and when they did arrive, they were frequently outdated and generally of very poor quality. The state is simply not as good as private capital at manufacturing the goods that society needs. However, things are different if we look at services. Capital is better at providing products or things, but the state is better at providing people, especially educated professionals who provide important services. Now, I'm not saying that the state should provide all services. On the contrary, I would argue that small-scale services are best provided by neither the state nor corporations, but by small businesses, which usually means family businesses. I'm talking now about things like hairdressers, restaurants, garages, corner stores, and so on. The state should not be trying to run enterprises like that, and it is not. However, the large-scale services that society needs should, I would argue, be provided by the state. Only the state can provide essential services on a national scale. Only the state can provide a national army, police, utilities, the transport infrastructure of road and rail, and above all, the three pillars of the welfare state: health, education, and welfare. Only the state can deliver large numbers of highly trained professionals like doctors, nurses, and teachers in nationwide organizations universally available to every citizen. Only a non-profit state-run organization can allocate resources, such as healthcare resources, on the basis of need rather than income. Only state-run healthcare can look after the health of society as a whole, not just of the rich. In short, only the state can provide care, not just cures. Capital provides machines, but machines cannot care. Only people can care for other people. The distinction between cure and care may seem fuzzy, but in practice it's been determined by just one thing: beds. Without beds, a healthcare facility is simply dispensing cures to customers, just like a store selling a product. But with beds, the facility becomes what's called a total institution, which is an institution that has total control over and takes total responsibility for the well-being of its residents. Although there is some disagreement over the terms, I would argue that beds are what turn a clinic into a hospital. As we saw in our history, efforts to establish such private surgical units in Canada have not been very successful. However, beds may also be found in long-term care facilities, including elder care facilities. And here, as we saw, the private sector has made substantial inroads. Elder care provides us with a model of what Canada's healthcare system as a whole would be like if it was privatized. And our look at Ontario's nursing home revealed some of the problems created by private care: abuse, neglect, theft, overcrowding, and so on. Private nursing homes have had to be forced by a series of laws to provide even minimally adequate care. While some of these problems can perhaps be eliminated by closer government oversight, others are built into private care, because the profit motive always gives owners an incentive to raise their profits by cutting costs. In nursing homes, this means things like allowing buildings to fall into disrepair, providing poorer quality food, providing poorer quality care, replacing trained staff with untrained staff, and so on. In any kind of total institution, this kind of cost-cutting will inevitably have a negative impact on residents' quality of life. On the other hand, state-run homes for the aged, free from the pressure to constantly make a profit, have taken a much more innovative and long-term approach to cutting costs. Instead of providing less services, they provide more. They don't try to get as many residents as possible so as to make as much money as possible. Instead, they provide alternatives to institutionalization so that as many seniors as possible can stay home instead of having to go to an institution. Homes for the Aged have developed a variety of outreach programs for the elderly, such as Meals on Wheels, daycare, vacation care, shopping services, and transportation services, with much of the work being done by community volunteers. Surveys show that most seniors prefer to stay at home if they can, and their doing so takes some of the pressure off our elder care institutions. The record concerning the treatment of elders in private and public institutions is clear. Private nursing homes treat their residents like objects to make money from. Public homes for the aged treat their residents like people, to be cared for, respected, empowered, and, the current term, reactivated. That difference is why there is no room for the profit motive in care. I would argue that not just elder care institutions, but all healthcare institutions that have direct contact with patients, such as hospitals, clinics, and psychiatric institutions, should be run by healthcare professionals, above all doctors and nurses, not by private managers or insurance claim adjusters. I would argue that it should be the responsibility of politicians of all parties to ensure that public healthcare receives the funding that it needs, so that such private positions become redundant. In general terms, I would argue that history has shown us that both corporations and governments are much too powerful and could do too much harm for either one to be allowed to run society purely on its own terms. When the state took over the economy in the Soviet Union, it led to a brutal dictatorship. But when the corporations took over American healthcare, it led to growing inequality, illness, and human suffering on a mass scale. State and capital should serve as check and balance for each other. They should rein in each other's excesses and stimulate each other to provide their best. They should complement each other, not compete with each other. Our society and our healthcare system needs a balance between state and capital, not a war between them. Privatization has tipped that balance in favor of capital, and we need to restore that balance in order to restore our society to health. After World War II, left-wing politicians like Tommy Douglas spent a generation building the welfare state, including Medicare. But from the late 70s on, right-wing politicians like Brian Mulroney spent the next generation introducing cutbacks to social programs like Medicare, and instead promoting privatization. Since then, the millennial generation has seen an uneasy truce between the two sides. In the 21st century, in the face of strong opposition from the majority of Canadians, most Canadian politicians have backpedaled on their proposals for healthcare privatization and have instead declared their support for the Canada Health Act and Medicare. But they have not acted to reduce the private sector. In 1975, the private sector got 23% of healthcare expenditure in Canada. With the help of the political right, this rose steadily for the next 20 years, reaching 32% in 1997. But since then, things have stabilized. The private sector's share today is still about 32%. We continue to have a healthcare system that's about 1/3 privatized. We continue to have a healthcare system that is mostly public, but that is chronically underfunded by the state and under constant attack from the private sector. This is a situation which cannot continue indefinitely. About 90% of the private sector's income goes to about 250 large corporations, some Canadian, many American. These corporations are the wolves that are just waiting to pounce, waiting for the first opportunity to kill Medicare and feed on its carcass. These corporations know that there are big profits in private healthcare. And when you care for profit as much as these corporations do, you find a way to care for profit. Only the Canadian government, with the support of the Canadian people, can fight off these corporate wolves and provide a healthcare system that meets the healthcare needs of all Canadians, not just the rich. Canada needs to show these corporations that we care for our health more than they care for their profits. And I believe that in the long term we will. Canada built Medicare once, and in the future we can, and I believe will, rebuild Medicare bigger and better than ever. But just when that will happen is something we'll just have to wait and see. That concludes what I have to say about private healthcare in Canada. A transcript of this talk is attached if you're interested. Good day all.